Have you noticed tingling, numbness, or sharp burning pain in your hands or feet after 60? Most seniors think it's just aging, but science shows that everyday vitamin deficiencies, especially vitamin B12, could be silently harming your nerves, and fixing it can make a huge difference. Why nerve pain happens in seniors? As we age, our nerves naturally become more fragile. Daily stress, poor diet, reduced absorption of key nutrients, exposure to environmental toxins, and even minor injuries can slowly damage nerve fibers. This damage shows up as tingling, numbness, burning sensations, or weakness in hands and feet. Many assume these are just signs of aging, but studies show that nerve health can improve with proper care, supplementation, and lifestyle adjustments. How widespread nerve pain is. Nerve pain after 60 is surprisingly common. In the UK, about 25% of adults over 60 report mild to moderate nerve discomfort, and in the USA, the figure rises to 28% of seniors. Despite being common, it is often overlooked, leaving many seniors frustrated and in discomfort. The earlier you take action, the better your chances of improving nerve function and reducing pain. The critical role of vitamin B12. Vitamin B12 is essential for nerve health. It maintains the myelin sheath, the protective layer around nerve fibers, and ensures smooth signal transmission. Deficiency is common in older adults due to reduced absorption, poor diet, or digestive conditions. Low B12 can worsen nerve pain, numbness, and tingling, but restoring healthy levels has been shown to relieve symptoms and improve mobility, energy, and overall quality of life. Common signs of B12 deficiency. You might be low on B12 if you notice persistent tingling or numbness in hands or feet, difficulty walking or maintaining balance, chronic fatigue or low energy, memory lapses or mood changes. If any of these signs are familiar, it's important to consult your doctor. Early intervention can prevent further nerve damage and improve symptoms more quickly. How to safely increase vitamin B12. You can boost B12 naturally through foods like eggs, dairy, fish, chicken, and fortified cereals. For some seniors, supplements may be necessary, especially if absorption is low. Your doctor can guide you on the correct dosage. Consistent intake is key, sporadic supplementation won't be as effective. Within weeks to months, you may notice reduced tingling, improved hand and foot sensation, and better energy levels. How B12 helps repair nerves. B12 supports nerve repair by strengthening the myelin sheath and improving signal transmission. It reduces tingling, numbness, and burning sensations, while boosting overall energy. Seniors who maintain healthy B12 levels often notice better coordination, more stable walking, and less pain during everyday activities. Combined with lifestyle adjustments, the effects are even stronger. Daily habits that protect nerves. Besides vitamins, lifestyle habits are crucial. Gentle daily activity, like walking, stretching, or yoga, improves circulation and reduces nerve discomfort. Avoid excessive alcohol, maintain stable blood sugar levels, and reduce exposure to toxins such as pesticides, processed foods, and harsh chemicals. Even small daily habits, if consistent, can have a major impact on long-term nerve health. Simple exercises for seniors with nerve pain. Toe and finger stretches improve circulation to extremities. Ankle rotations reduce tingling in feet. Light balance and strength exercises prevent falls and improve mobility. These exercises are safe for seniors and can be done at home. Practicing them daily helps maintain independence while reducing nerve discomfort. The power of consistency. One-time measures rarely bring results. Daily B12 intake, regular gentle exercise, and a balanced diet over weeks and months can dramatically improve nerve health. Many seniors report noticeable improvement in comfort, reduced numbness, and more energy after committing to these simple habits consistently. Small, steady steps matter more than occasional efforts. Real-life examples. Take Sarah, 67, from the USA. She experienced tingling in her feet for years and thought it was normal aging. After her doctor recommended a B12 supplement, a few dietary changes, and daily stretches, she reported significant improvement within a month. Her energy returned, her walking became steadier, and the constant discomfort in her hands and feet diminished. Encouragement and motivation. Remember, nerve pain after 60 isn't something you have to accept. With the right vitamin, lifestyle changes, and medical guidance, you can regain comfort, protect your nerves, and continue doing the activities you love. Age is not a limit, action is key. Conclusion: take control of your nerve health. Nerve discomfort doesn't have to define your life. With vitamin B12, healthy lifestyle habits, and regular checkups, you can reduce pain, regain mobility, and stay active. Start small, stay consistent, and you'll see real results in your daily life. If this video helped you, like, share it with a friend or family member over 60, and subscribe for more expert-backed tips for seniors. Hit the notification bell to never miss simple and effective ways to protect your nerve health and enjoy your golden years comfortably.